Steroids by Sean Giroux and Quinn DeBolt.
Something to think about. Which of these are not considered a steroid? Birth control, HGH, decadurabolin, or whey protein? Whey protein is not a steroid. It is a mixture of globular proteins isolated from whey. Birth control, on the other hand, is a steroid. Progesterone were effective as a contraceptive in preventing pregnancies. HGH is a legal natural growth hormone. Decadurabolin, commonly used to treat renal insufficiency and anemia.
There are three types of steroids you can use: anabolic, androgenic, and also my personal favorite, cortico.
Androgenic steroids effects are seen as the growth or thickening of the body's non-reproductive tract tissues, including the skeletal muscles, bones, the larynx, vocal cords, and decrease in body fat. Androgenic steroid effects are seen in the growth of the male reproductive tract as the development of male secondary sexual characteristics. Medically, anabolic steroids were given for the osteoporosis in women, but is not recommended nowadays. It can also be used to treat the vascular manifestations of Behçet's disease, for hereditary angioedema, to treat aplastic anemia, and to reduce the itching of chronic biliary obstructions.
Back to my favorite, corticosteroids. Corticosteroid is a generic name for the group of hormones that have a cortisone-like action. It's a man-made steroid that mimics the activity of cortisone. Cortisone is produced naturally in the body and is involved in regulating inflammation, thus dealing with injury. Corticosteroids are not the same as anabolic steroids. Corticosteroids are used in the treatment of many diseases like asthma, eczema, allergies, arthritis, colitis, and also kidney disease.
Anabolic steroids. The large muscle mass of males is because of the nitrogen-retaining effects of androgen. They may have a property of protein building and when taken lead to an increase of muscle mass, bulking, and strength. The term anabolic is derived from the Greek word that means to build up, though the proper term is anabolic androgenic steroids. Anabolic steroids is the most familiar term to people. Some street names are Roids,
Juice,
Arnold's,
Hype,
Weight Trainers,
Jim Candy,
and Pumpers.
There are tons of signs of using steroids. A few of them we have here are rapid weight gain or muscle development, acne flare-up, fluid retention, mood swings or depressive, aggressive behavior, and also premature balding.
Side effects for men in the hormonal system include infertility, breast development, shrinking of the testicles, and for women in the hormonal system, enlargement of the clitoris, excessive growth of body hair, and for both sexes, male pattern baldness, musculoskeletal system, short stature, tendon rupture. In the cardiovascular system, it leads to heart attacks and strokes, enlargement and hardening of the heart and left ventricles. In the liver, you can acquire cancer and hepatitis. Skin, you'll get extremely oily scalp and have tons of acne. Infection, you are risking HIV or AIDS. And psychiatric effects, you might go crazy, have mania and delusions. Home remedies which have the same side effects or even worse as normal steroids include cortisone steroids, which include tendon ruptures, plastic surgeries, risk of infection and blood clots, Viagra, which causes vision problems, diarrhea, and dizziness, and also cosmetic surgery, which is as vain and as fake as anabolic steroids.
On January 17, 2013, cyclist hero/fraud Lance Armstrong finally had a live interview with Oprah Winfrey on his use of steroids. Here's a voice reenactment of the interview.
So Lance, why do people use steroids?
Well, that's easy, Oprah. It makes people bigger, faster, and just overall stronger.
Do you think athletes should be allowed to make this moral trade-off?
Well, Oprah, it's my life. It only hurts me as an individual. Why does society care what I do?
Society cares because steroids is a form of cheating. It creates an unfair advantage for those who do not use the drug. Some anabolic steroids are taken orally, others are injected intramuscularly, and still others are provided in gel forms and creams that are applied to the skin. People can abuse steroids by taking 10 to 100 times higher the dose than the medical conditions allow.
Steroids are often abused in patterns called cycling. Cycling involves taking multiple doses of steroids over a specific period of time, stopping for a period of time, and then starting once again. Users also frequently combine several different types of steroids in a process known as stacking. Steroid abusers typically stack the drugs, meaning taking 2 or more different anabolic steroids, mixing oral and/or injectable types, and sometimes even including compounds that are designed for veterinary use. Abusers think different steroids interact to produce an effect on muscle size that is greater than the effects of each drug.
Another mode of steroid abuse is referred to as pyramiding. This is a process in which users slowly escalate steroid abuse, increasing the number of steroids or the dose and frequency of one or more steroids used at a time, reaching a peak amount at mid-cycle and gradually tapering the dose toward the end of the cycle. Often steroid abusers pyramid their doses in cycles 6 to 12 weeks. At the beginning of a cycle, the person starts with low doses of the drugs being stacked and then slowly increasing the doses. In the second half of the cycle, the doses are slowly decreased to 0. This is sometimes followed by a second cycle in which the person continues to train without drugs at all.
There is a great deal of physical and psychological dependence on steroids. Steroid abusers typically spend a large amount of time and money obtaining the drugs, which is another indication that they are addicted. People who abuse steroids experience withdrawal symptoms when their cycle is over. Indicators of withdrawal symptoms include mood swings, insomnia, depression, and possibly the worst one, reduced sex drive.
Steroid withdrawal must be medically managed by an endocrinologist for the safest possible drug detox. The major health problems created by steroid abuse are related to the alterations in the level of hormones in the body. Steroid withdrawal must be closely monitored and specific steroid taper needs to be prescribed. Severe depression is the most common psychological side effect of stopping steroid use. Recovery Connection recommends going to a medical detox center because they are the best equipped to prescribe medications for depression.
Steroid detox, which removes steroids from the body, does not help with the severe self-esteem and psychological issues that may be the underlying issue for those struggling with steroid addiction. Withdrawal symptoms can mimic other health problems and can include weakness,
This informational video entitled Steroids was brought to you by
the Western Michigan University Exercise Science Program.